Implant technology has evolved greatly over the last 20 years, I would say, specifically in the last 10 years. For instance, there's an implant right here. You can see the metal portion and the crown portion. When this person lost his tooth, there just was not enough bone in the area. There's not enough height to the bone, and there was not quite enough width to the bone to be able to place a stable implant in there. The sinuses were shaped kind of like this. They came way down over the tips and the roots of the teeth. So a sinus lift was done, and you can actually see the difference here in the bone. There is no bone here. The floor of the sinus was lifted. Synthetic bone was added. It becomes the patient's bone completely within about 6 months. Then there was plenty of bony structure to allow an implant to be placed and restored. In the lower arch, we can also now widen the mandible or the jaw. We can add to it where we need to. We can actually stretch it. Bone is actually fairly soft, and it allows us, if you do it correctly and don't overdo it, you can make a lot of changes to allow implants to be placed. Part of all this technology is having the right x-rays and radiographs, and so about 6 years ago we were fortunate enough to be able to purchase a cone beam CAT scan machine. We've had CAT scans at the hospital, that kind of thing. This machine, which we have on premises, basically just does the chin to the eyes, but it allows us to see everything in 3 dimensions and very accurately measure everything, so we can pre-plan where the implant's going to go, what size it's going to be, and basically kind of start the whole surgical procedure ahead of time. Implants come in many sizes, both height and diameter. We have one particular company we use. We place their implants. Then when the restoration happens, it is with our dental lab, and it's the same dental lab that does our crowns and bridges for us. We worked together with them for several years, so they know just how we want those implant crowns to be shaped. There's a few subtle differences that need to happen, and they do very well with it.